Hello there. I'm Dr. Bernardo Ng, psychiatrist and medical director of Sun Valley Behavioral Medical Center. Thank you for watching and welcome to one more mental health tip from Sun Valley Behavioral. Today we're going to talk about anxiety. Anxiety. What is anxiety? Well, anxiety, first of all, is a normal reaction to any threat of danger. Okay? So, like a house or a car, our body has an alarm system that warns us that something dangerous might happen or is about to happen or is happening. And it's like an alarm, right? However, in some people, this alarm may go off when there isn't danger out there. And the alarm can be activated because of a thought, because of a cue, or even out of the blue, okay? So when that happens, there is an anxiety reaction with fear, worry, distress, and also with body responses like your heart racing, you're sweating, you're shaking, your stomach may play a one on you, right? You can have diarrhea, you can have constipation, your blood pressure may go down. So it's a systemic reaction when you have anxiety. Now, it's normal to have anxiety when something happened. It's usually short-lived, but just think about it. People that have an anxiety disorder or an anxiety disease, they're constantly like that. Anyway, so there are different anxiety disorders depending on how the anxiety manifests. But when you put them all together, up to 28% of the population have some form of anxiety. My God, that's almost 1 in every 3 people. But slow down. For example, anxiety could be phobias, okay? And you could be afraid. Phobia means that you're afraid of something. You could be afraid of snakes, afraid of cockroaches, afraid of bees, and all of those are phobias and are considered anxiety disorders, right? Now, you could also have generalized anxiety disorder, and that's where everything day to day worries you, and you're constantly scared that something's going to go wrong. That if you drive out to work, you're going to have a flat tire, or you're going to run out of gas, or you're going to have an accident, even though there's no reason to believe that. You could also have panic disorder, and that's a full-blown reaction of anxiety that lasts just a few minutes for no reason, out of the blue. And it goes away within seconds, at most a couple of minutes, but you're constantly in fear that you're going to have another panic attack. There are people that actually quit doing things or quit going to certain places because they are afraid they're going to have another panic attack. Okay? And then a very interesting one, you probably heard about it, social anxiety disorder. And it is this fear of being observed, being criticized, being ridiculed because you're going to do something and you're going to mess up. You're going to screw up and everybody's going to laugh at you. So people end up being afraid of going for their dreams, going for their plans because they're afraid they're going to mess up in the middle of that. And so it's a real disease, it's a real problem. Anxiety disorders can start in childhood and keep on going all the way through your lifetime, and they have treatment. That's the interesting part. The first step of treatment for anxiety is psychotherapy, depending on the kind of anxiety. From exposure therapy, like for example, be exposed to snakes or cockroaches or spiders, to elevators, afraid of driving up the hill or in bridges, taking an elevator. So exposure therapy, behavioral therapy. Then generalized anxiety disorder works with, or can get better with cognitive therapy. Panic attacks can get better with breathing relaxation techniques. And social anxiety can get better with cognitive behavioral therapy. Now, when these therapies don't work or only work partially, we have medications that help complete the treatment, and they usually consist of medications that also work for depression, but also work for anxiety. These medications are safe, they're not addictive, you can take them for years if you need to. They're very rarely harmful, and in general, they're very easy to take. At the beginning, you do have side effects, and sometimes that scares people, especially people with anxiety, but in general, very safe and very successful. Okay, thank you for listening to another mental health tip from Sun Valley Behavioral Medical Center.